Good afternoon. Our speaker today is an assistant professor of leadership studies at Louisiana State University, Shreveport. She received a PhD in communications from Purdue University. Her master's is in communication studies with a certificate in corporate communication and training from Texas State University. And she also has a bachelor's in corporate communication with a minor in leadership studies from Washburn University. She studies specifically healthcare providers' communication techniques that are useful for explaining medical information and establishing positive relationships with patients. Another research area she explores is healthcare literacy and message translation, evaluating message clarity to identify areas of improvement and instructing healthcare providers in clear communication techniques by conducting communication trainings. Please join me in welcoming Dr. Grace Hildenbrand.
Hi everyone, it's such an honor to get to be here and get to talk to all of you today. So thank you, those of you that are here live, and I know that some of you are here virtually via Zoom as well. So I wanted to start off by telling you a little bit about why I decided to study doctor-patient communication. So when I was finishing up my master's degree several years ago, I took a critical health class, and for my final project in this class, I was analyzing a training that was given by a medical doctor, and he was talking about challenges with doctors communicating with patients and this communication training that he created. And throughout his presentation, he was saying things like, communication is so simple, it's not rocket science, but you still have to practice even if it's easy. And I was thinking to myself, I think that there's this need for communication scholars to partner with medical doctors or healthcare providers to research and do training related to communication. And so I thought that's where I really want to focus from now on with my research. And I found out there are a lot of really neat partnerships that are going on between communication scholars and health practitioners. So as was mentioned in my introduction, there are three main areas of focus with my research. One is looking at training for healthcare providers in communication. Another area is researching communication strategies that you can use to facilitate a positive relationship with patients. And then third, where I'm going to focus for today's presentation, is about how to effectively explain health information in a way that is easy for patients to understand. So I'm guessing that many of you probably get asked, or at least when you were in medical school, what your specialty was, and people also ask me, what I study. And when I tell them that I study doctor communication with patients, they don't typically just say, oh, that's cool. I get other reactions. So one reaction that people give me sometimes is, wow, that's really important. Another one is just saying, thank you. Third is somebody saying, oh, I've got a story to tell you about some interaction with a healthcare provider. Or fourth is, you need to talk to this doctor. And with number 3 and number 4, they typically have a really, really excellent example of working with a healthcare provider or a really negative experience that they want to share with me about that. And just briefly, I wanted to show you a list of some of my publications related to doctor-patient communication, but that's not my main focus today. There's 4 things I really want to talk about today. One of them is why I think it's important to study provider-patient communication. Second is looking at medical jargon. Third is health literacy. And lastly, I want to talk through some clear communication strategies that you can use when you're interacting with patients. So the first set of reasons why I think it's important to give attention to provider-patient interaction, one is because it's really hard for many patients to adequately understand health information. And so according to this medical expenditure panel survey of US adults with chronic health conditions, only about 60% of them felt like they could adequately understand information that they were getting from their healthcare providers. And in a recent malpractice report, about 50% of oncologists who are surveyed said they think that the best way to decrease the chances of malpractice is to have good communication with patients. And third, I think that if we want patients to be able to adequately adhere to treatment, they need to first understand health information and also remember it. And I think that's really important. And then if you can communicate information in a way that's clear to patients, that may result in creating this positive relationship with them. They might continue to come see you, which promotes continuity of care, and that's also positively associated with health outcomes. So a second set of reasons why I think it's important to study provider-patient interaction is because it is part of the Healthy People 2030 objectives. There's a few of them related to communication. So one of them is to decrease the percentage of people saying that communication with their providers was poor. Second is to increase the proportion of adults with limited English proficiency who say that their providers explain things in a clear way. And third is to increase the proportion of adults who said that their providers checked that they understood the health information. A third set of reasons why I think communication is important is because of HCAPs or CAPs, which are the surveys that are sent out to patients after they stay at a hospital, and those results are publicly reported. And there's 3 questions on there that relate to doctor communication. So the first one, how often did doctors treat you with courtesy and respect? Second one, listen carefully to you. And third, where we're focusing today, is how often did they explain things in a way that you could understand? So I thought, well, if these are publicly reported, why don't I look up the results for Ocean or LSU Health Shreveport? And I did look these up a couple of months ago, so it's possible that they're different today. I'm not sure how often they update it. And so this rating here is for the overall survey, not specific to communication. And important to note here is that there's only a 13% response rate, so very, very low response rate for out of the total number of patients that were sent the survey. But I did go ahead and look up what I could find about communication results. So you can see that 77% of patients who filled out the surveys thought that their doctors always communicated well, and then just under 50% said they strongly agree that they understood their care upon leaving the hospital. Another reason why I think it's important to study provider communication is because of these accreditation agencies and their emphasis on communication. So you can see here that we've got interpersonal communication skills being a core competency here, and specifically focusing on communication with patients and families, and then here as well for the Commission on Dental Accreditation, that they also have one of their accreditation standards is focused on interpersonal skills and communication skills. So I mentioned earlier that it can be really challenging for patients to understand information about their health, and one reason for that is because of medical jargon, and that can be really challenging for people to understand if they don't have a clinical background. And so I wanted to talk a little bit about jargon, and this quote that I've got on this slide is from Pitt and Hendrickson, who are 2 medical doctors, and they came up with a classification system for jargon that I'm going to be showing you here in a little bit. But they say in their article, "None of us went into medicine to confuse people, yet studies on our use of jargon reveal that we consistently do precisely that." And I'm going to show you some examples of those studies. So I've got a couple definitions of jargon that I liked. One of them is just jargon in general, and the second one is more specific to medical jargon. So the technical terminology of a given group, or any medical terminology which is unfamiliar to people without clinical experience. So with this, there's a couple studies I wanted to report on healthcare provider use of jargon. This first one was for surgeons talking to parents who had kids with sleep disordered breathing issues, and they found that the surgeons were using jargon an average of about 30 times per visit. And in this second example, they were looking at inpatient morning rounds over 12 weeks and found that about 70% of jargon terms were not being explained by providers, and there was an average of between 4 and 5 undefined jargon words per interaction with each patient. And then I thought, well, I'm talking to medical residents today, so let's see if I can find research specific to residents and their use of jargon. So I found a few studies here as well. So this first one looking at pediatric residents and their use of jargon, this was interactions with standardized patients. They were talking about newborn genetic screening results. And they found that you can see there were an average of 72 total jargon words per transcript, but only 20 unique jargon words, so 20 words that were different from each other. So of that 20, jargon was explained an average of 7 to 8 times per encounter. So you can kind of compare that, how often it was explained to how often those terms were actually used. In this second example, these were internal medicine residents from the University of Pittsburgh interacting with patients, not standardized patients. About 70% of them used jargon or vague language, and none of them used what's called the teach-back technique, which I'll talk about a little bit later. This third one, again, looking at internal medicine residents, but here they were looking at feedback that they were given from faculty members. So what kinds of feedback were they being given about things that they can improve on or work on in their interaction with patients. And so what was most commonly given as feedback to them was this category they called educating patients. So things like, make sure you're avoiding jargon, make sure you're explaining things clearly and checking to make sure that the patient understands that information, as well as they were not using the teach-back technique, which again we'll talk about. Then a final example, so in this case, the medical residents were using an average of about 2 jargon words per minute, but almost 90% of them felt like they were communicating clearly or perceived that they were communicating clearly. And this phenomenon is what Pitt and Hendrickson called jargon oblivion. So this idea that maybe as a speaker, you think that you're communicating very clearly, but maybe the person receiving the information is confused or doesn't actually follow or understand the information. So I wanted to give you some examples of types of medical jargon. So with this first example, these were interactions between third-year medical students and standardized patients, and the encounter here was about interacting with supposedly a parent with a child who had strep throat. So that's kind of the context for these particular jargon words. And so you can see there were 123 total encounters, so the number to the right is the number of encounters that use that jargon word, and then to the right of that is the percentage of encounters or transcripts. So you can see that for strep, antibiotic, and test, those top 3, virtually all of the medical students use those words at some point in the interaction. But even for all 10 of these words, the lowest percentage is 59%. So over half of the medical students used all of these in their interactions. And to be fair, I don't know if this one, they didn't mention if they were explained or unexplained jargon terms. It was just use of jargon. So I'm not exactly sure what percentage of these terms were explained. So here's another example of some jargon terms. But this one, instead of looking at words that were used by healthcare providers specifically, they asked patients to define these words, and then they looked at how many could they correctly identify or incorrectly identify. And so these were patients who had cancer and were either taking chemotherapy or had recently agreed to start getting chemotherapy treatments. And so the percentages here are the percentage of patients who did not correctly define the terms. And so that's the percentage here, and then the confidence intervals to the right of that. So in this case, you can see for maintenance and palliative that virtually all of the patients incorrectly defined those. And again, with this list here, even the lowest percentage that I've got here above, that's 54%. So half or more of patients were incorrectly defining these words, and these are patients who have cancer. Then there's 2 different classification systems for jargon that I wanted to show you. I just think it's helpful to have an understanding of there could be different types of jargon. So this first one is from Links and colleagues. The first category they just call medical terminologies, which is what I think we think of with jargon, so terms that people without a medical background maybe don't know at all, maybe have heard of but don't really know what those words are, but many people would not recognize them, like tonsillectomy or anesthesia. Next is contextual jargon, which are words that have one or multiple meanings in the medical field and a different meaning outside of the medical field. So these can be especially confusing for people because it's the same word, right? So words like contact or test, with contact, there's many meanings. I was thinking like contacts for your eyes or like phone numbers, emails, contact information. Then third is complex language. So this is just language that it's not specific to the field of medicine, but just complex or complicated words. So words that are kind of flowery or decorative that are just unnecessary, like copious or diligent. And then lastly, statistical language. So percentages, ratios, proportions, numbers that could be confusing for people, such as risk of post-op bleeding in 2 to 5% of kids. That can be confusing for some patients. So this is a separate classification system that I wanted to show you. This is from those 2 medical doctors who I quoted earlier on, Pitt and Hendrickson. So this one has more categories to it, but it does not include the last 2 categories from the last one. So there's no statistical language here, and there's no category for just complex words in general outside the field of medicine, but I think it's good to think of those as jargon as well. So their first category is what they call technical terminology, just words that you probably wouldn't have known before medical school. So this is often names of diseases or procedures, such as myocardial infarction. Second is acronyms and abbreviations. This is a good one, right? So EKG, STAT. These may be terms or phrases that you might use out loud. You might be writing them down, and that could be confusing for patients as well if they don't know what they mean. Then third up is medical vernacular. And this, I personally think there's a lot of overlap between this and technical terminology, but they say these are words that people are familiar with but may not be able to correctly define. So they're like, oh, I've heard of that. Maybe they heard it on like a medical TV show or something, but maybe they don't really know what it means. So like ulcer or inflammation or acute, for example. Then they have medicalized English. This is the same as the contextualized jargon from the last classification system. So again, those words that are the same word but have different meanings depending on the context. And they said it's especially problematic when they're what they call accidental antonyms, so words that have the opposite meaning. So this is especially important when we think about tests and how the words positive and negative, and if you think about those in a medical context versus if you're taking a test for a class in school or something, you know, it's virtually the exact opposite meaning, which could be confusing potentially. Then they have what they call unnecessary synonyms. So this is big words, complex, complicated words that are specific to the field of medicine, but they're just unnecessary because there are other words that you could use in place of them. And so words like, or phrases, I should say like oral intake, you could just say take by mouth. Then there's two more. Euphemisms, so that is maybe you're trying to soften the language, make a situation seem less serious, but that could be misleading. So if you're saying something is just a spot and it's something that's actually really serious, that could be misleading and confusing for people. And then lastly is judgmental jargon, so words that are biased or seem biased to some patients. So there's been research done that showed, for example, some patients do not like it when they have, you know, their main concern is called the chief complaint, or if they're labeled as being non-compliant, for instance. All right, so this is a neat study that came out just this year where these researchers used that classification system, that second one I just showed you, and they actually applied it to interactions with their primary care providers and patients, which these were college students because this was a student health center. And they found that jargon was used about once every 4 minutes, and about 80% of those encounters had at least one jargon word that was not explained. Only about half of the jargon was explained. And then they looked at those categories and saw like how common were they in terms of their primary care providers using the jargon. So technical terminology and medical vernacular were the top two most common, which is, you know, what we think of when we think of jargon, so those words that maybe people have never heard of or patients might be somewhat familiar with. And then next up was acronyms and abbreviations were most frequently used, followed by the medicalized English, those words that have different meanings depending on the context, and then lastly was unnecessary synonyms. I always want to say symptoms instead of synonyms with that one. So there are some negative outcomes of jargon, and I will say this first study I'm going to show you is not about jargon per se, but I think that jargon maybe either played a role or could make these percentages worse potentially. So this was a systematic review and meta-analysis of about 50 studies where they looked at patients' ability to remember recall instructions upon leaving the hospital, and they found that recall range from about 47 to 67%. So that means there's a lot of information that they're not remembering that they were given upon being discharged from the hospital. And this is important because if patients don't remember information about their health, then they're going to be less likely to adhere to treatment, which is negatively associated with health outcomes. So this second study, this was an experiment where they were looking at science information, and they found that when the science information was described using jargon, that participants had more trouble understanding it, and they were more resistant to persuasion about it. So they were less likely to do what they were being asked to do. And then this last study on this slide was a qualitative study. They interviewed parents of kids with chronic illnesses and found that parents felt like when doctors were using jargon that they were using it as a strategy to intentionally try and avoid talking about the issue more and avoid asking questions. So they saw it as kind of a negative strategy that was being used potentially like on purpose by doctors, whether or not that was actually the case. So we've talked about different kinds of jargon, and I wanted to give you a chance to kind of imagine what it might be like to be a patient who struggles to understand jargon terms, because you all have this incredible amount of knowledge, which is so impressive, right? And it might be hard to remember what it was like to not know what some of these terms mean. So I just wanted to give you some examples. So this study, I cited this one earlier as well, but this is the one where we have cancer patients receiving chemotherapy, and they had trouble understanding a lot of these jargon terms. So here's some examples of how they incorrectly define some of these terms. So radiation, when you get in a machine to see if anything has spread, or another version of chemotherapy. For biopsy, one of them said something that you take like a medicine. Then you can see 4 examples here, such as a machine, ultrasound, a surgery to take the cancer out, blood count, measure to see if the blood pressure is up or down, or a test to see the stage that my cancer is in. And that brings me to Dr. Lisa on the street. This is Dr. Lisa Fitzpatrick. She's a medical doctor, and she goes around her city. I want to say maybe it's Washington, D.C. I don't remember, but it's some big city. And she just interviews people on the street and asks them to define jargon terms or ask them questions about health, and she just sees what they say. And if they have misinformation, she will correct it. So she'll just explain to them what they need to know about the health issue. So it's pretty neat. So what I wanted to share with you today are some examples of incorrect answers. And to be fair, I would say probably half, if not more than half, of people she's interviewed do get the correct answer. But again, I wanted you to kind of think about what it might be like to not understand some of these terms. So or questions, really. So she asked this person to define exacerbate, and he said, I don't know that word. She asked this person to define exacerbate. He said, injure, strain, I don't know. She asked this person to define aspirate, I don't know. Then she asked these two to define hypertension, and the young woman said, you can't extend your arm. And she kind of went like this when she said it. She's like, it's when you can't extend your arm like this. So then she asked a specific question here, what if I gave you antibiotics to treat the flu? Would it help? And he said it would. She asked these two the same question. So if I gave you antibiotics to treat the flu, would it help? And he said, I'll do amoxicillin if I'm starting to feel a sore throat. And then she asked, why do you go to the emergency room? And he said, for high blood pressure and to get a physical. And then she asked this group of young men, what do you need a gallbladder for? And one of them said, when you urinate. So yeah, so examples of people, they had an answer, right? Sometimes they had no clue, sometimes they had an answer, but a lot of times it wasn't the right answer. And that brings me to health literacy. So many patients struggle to understand health information, but this is especially difficult for patients who have low health literacy. And the reason I have 2 definitions up here is because I think the CDC changed it just this year. Because of Healthy People 2030, they made a couple modifications. So I don't know. This isn't really, sorry, that's really loud when I get close, but it's not as clear up here, but I bolded the main differences here on the right. So the right is the newer one. And I think the difference is that now they're emphasizing using the information more as new, and then also not only making decisions for yourself, but also for other people. Those are the 2 kind of, I would say, additions to the definition of health literacy. But it's really about having access to health information, being able to understand it, and being able to use it to actually make good health decisions. So there's several different parts to it. One is numeracy, so using numbers, and so you can think back to when I mentioned the statistical jargon category, that can be especially problematic as a form of jargon for patients with low health literacy if they struggle to understand information related to numbers. Next is literacy, so being able to read. What knowledge people have about health, and of course that's going to vary a lot from person to person based on what issues they've had or people they know, what jargon terms they know or don't know. Visual literacy, this is about interpreting charts and graphs. Okay, that's what visual literacy focuses on. And then computer literacy, which I would really expand to electronic device literacy, because so many of us use our phones today to find information. I would add to using the internet, knowing how to navigate the internet, social media, and then information literacy, being able to look at information and decide for yourself, is it accurate or is it not, being able to evaluate the quality of that information. So there's a lot to health literacy, and that makes it really hard to measure, but we're not going to focus on that in particular today. So it impacts a lot of things negatively, and this slide focuses mostly on communication. So unfortunately, when patients have lower health literacy, it makes it harder for them to communicate effectively with you. So it makes it harder for them to share information. They tend to be less willing to ask questions and be less effective at talking about their health issues. And it makes it harder for them to understand what you are telling them. as well as it can negatively impact how they move through the healthcare system. So this is just a study showing that indeed patients who have low health literacy tend to ask fewer questions than patients who have high or adequate health literacy. That came out a few years ago. And this slide is focusing more on negative health outcomes associated with health literacy, just to show you that it really is a very important issue. So in this first study, they were looking at older patients with low health literacy and found that they remembered less health information than those who had adequate health literacy. Then patients with low health literacy also tend to go to the emergency department more often. They are less likely to take their medications as they were prescribed, and they're less likely to get preventive care. They're also more likely to be readmitted to the hospital. They tend to report having a lower quality of life and less social support from friends and family. And these are just low health literacy patients in general, regardless of age, and that they tend to be more nervous in general. And then this last study was looking at the medication adherence issue in particular. And again, this one was looking at older patients with low health literacy. And so they were looking at, well, what is it about medication adherence that they're struggling with? And they found that they tended to forget to take their medication more often, and they also, when they did, tended to take less than what was prescribed. So according to the CDC, about 90% of US adults have what they call inadequate health literacy, which they define as having a hard time understanding information that's complicated or new related to health. But then looking at percentages related to numeracy and literacy, about 20% of US adults fall into the lowest literacy category, and about 30% of them fall into the lowest numeracy category. So these are people who probably have low health literacy and really struggle to understand health information. And so I wanted to do a little bit of research to see, is low health literacy an issue here in Shreveport or at LSU Health Shreveport? And so I found this needs assessment that was done this year, and sure enough, everyone who participated in this needs assessment said that health literacy was a challenge for obtaining care. In fact, it was low health literacy was the number 4 barrier to the top 5 barriers to accessing health that was reported in this needs assessment. And then I found this map from the United Health Group or chart. And so the yellow are the counties, which I know they're called parishes here. I just moved here and I'm learning, but I will probably say county again and mess it up, so I apologize. But maybe some of you moved here in the same boat, so fairly recently. So the counties or parishes with the yellow have the highest health literacy, and then with the blue, the lighter colors are higher health literacy. And then as you move to the darker colors, those tend to be lower levels of health literacy. And again, since I recently moved here, I don't know if I'm exactly right here, but I think this is Caddo Parish. And if that's the case, then we are in one of the lower health literacy areas. Like we're in one of the lower health literacy counties or parishes. So all of this is just to say that low health literacy is an issue here in this community in particular, which makes sense based on the last slide. So many patients with low health literacy struggle to understand information, but the strategies that I'm going to tell you about communication are useful when communicating with any patient. And this aligns with the universal precautions approach. This is from the Agency for Healthcare Research and Quality, and they say that it's really hard to tell, if not impossible, that someone has low health literacy just by looking at them, just by talking to them, just by looking at their education level. So rather than trying to figure that out, you can just use clear communication strategies with everyone, all patients that you talk to. So this source by Coleman, I'm going to mention a few more times because what they did was Coleman and colleagues, I should say, they talked to 25 different health literacy experts and had them rank order 32 communication strategies that they thought were ideal for interacting with patients with low health literacy, and they rank order them. And so the universal precautions approach was number 4. So that's pretty high up on that list if we're talking about 32 strategies that they recommend. Just a little bit of information before I go over the clear communication strategies about health literacy and communication. So Unfortunately, patients who have low health literacy also tend to be less satisfied with communication with their doctors, but when they use clear communication strategies, that helps them better understand information. And I will say, too, that focusing on doctor communication is really just one strategy to address health literacy. Like, I'm aware that this is not the only solution, but because I'm talking to you all today, that's where I'm focusing my attention. So every strategy that I'm going to talk about is recommended by the AHRQ and their health literacy toolkit, and recommended by that panel of health literacy experts that I mentioned a little while ago. So what I'm going to cover is avoiding or explaining medical jargon, breaking up information into chunks, so typically between 1 and 3 main points, and using repetition to remind patients of what you're telling them. And then lastly is to use the teach back method. So one strategy, where appropriate, is to just try and avoid the jargon altogether. So instead, okay, I'm getting ahead of myself. This is the number 1 clear communication strategy recommended by those health literacy experts. So this is highly recommended by them. And so you can use other language instead. So a lot of times I like to call it plain language, but it's just what you might call lay terminology, non-medical, common terms. Think about how you would explain it to a family member or a friend who is not in the field of medicine. So you could say cancer rather than carcinoma, for instance. And then trying to avoid, as mentioned earlier, that contextualized jargon or the medicalized English category where we have words that have different meanings depending on the context, because again, that can be confusing, words like positive, or just explaining them if you use them. But this slide we're focusing on avoiding. And one strategy that you could use here, depending on the situation, is using the patient's word to describe the illness. So let's say a patient comes in and they have a runny nose, or they're complaining a lot about snot. And instead of you responding by saying, okay, well, what color is that mucus, or just inserting a jargon word, you could just say snot again, like what color is your snot? So just using their words back to them to talk about the issue as a way to avoid jargon, if that feels like what you should do in that situation. So in this study, these were diabetes patients who had low health literacy. And unfortunately, they could not adequately understand or comprehend information from the doctors when they use jargon. So just evidence showing that indeed, especially with low health literacy patients, using jargon does negatively impact their understanding. And then this was a qualitative study that did focus groups with patients who had pulmonary nodules. And these patients said they did not like it when their doctors used jargon. They did like it when they used plain language. And they especially liked it when they described the issue in context. So instead of just saying, it's this big, this many millimeters, they would say, oh, it's about the size of a pea. They really liked getting that context. Then, in certain situations, it makes sense to actually explain or define the jargon term. So use it and then just define it. This is also the number 1 strategy recommended by the health literacy experts. And this is because they combined avoid and explain into one category. So that's why they're both ranked number 1, if that seemed weird. So just say the jargon term and then define it immediately after. So you could say alopecia means hair loss, abrasion means a scrape. And then, I don't know if this is an important distinction, but when I say explain, I just mean elaborating a little bit more. So in certain situations, maybe it goes beyond just saying a little phrase, but maybe you're talking about a procedure and you want to actually spend a few more sentences explaining how it works. So that, to me, is more like explaining versus defining, but it's up to you how in-depth you want to go with talking about that term. So this is an example of information I found online related to hypertension. And you can imagine that if you were going to diagnose a patient with hypertension who didn't know about it, this paragraph contains a lot of jargon. I'm not going to read it word for word, but I'll just point out some of the jargon terms that are here and not defined. So we've got hypertension, which says what it leads to, but is not defined. Then it talks about increased mortality, comprehensive risk assessment with multiple measurements, selecting the optimal intervention, antihypertensive therapy via drug treatment. So a lot of jargon terms that are not explained in this example. So this would be an improved example. I'm not saying this is a perfect example, but it's got some pretty big improvements here. So still, in this case, we're going to explain what hypertension is, because if a patient is being diagnosed with hypertension, it's probably important that they know what that means, because they're going to be looking up information about it. They might be talking to other providers about it. So defining it in this case saying means your blood pressure is high, and then they might say, well, what's high blood pressure? Then you explain what that is. So it's when your heart is pumping a lot of blood and so on. So I would say that's an example of explaining it where you go a little bit further. And so instead of saying increased mortality, say die sooner than normal, and then can give you medicine instead of saying the antihypertensive therapy via drug treatment. So can replace in some cases and define, but still use the jargon in others. This is a study by the researchers who created that first classification system for jargon, and they gave examples of medical doctors using jargon or explaining it or avoiding it. So first example, just saying tonsillectomy and not describing it. Second one, just saying sleep apnea and not explaining it, versus instead of saying tonsillectomy, just not saying it. So saying the treatment is to take out the tonsils. Or instead of just saying sleep apnea and moving on, defining sleep apnea. So sleep apnea, which is the pausing and breathing when he's sleeping. So this again was the study where they were looking at cancer patients who were getting chemotherapy and they struggled to understand those jargon words that we've looked at already. So what they did was they chose the top 6 words that they were having the most trouble understanding. And they created these videos. I think they were animated videos where they just explained the words and then they measured their understanding again after watching the videos. And sure enough, their understanding of the terms increased by at least 20% or more for all 6 terms, which makes sense, but is just evidence showing that indeed if you explain the jargon, it helps patients to better understand those terms. So another strategy is just to simplify the communication. So breaking up a lot of information into smaller chunks. So thinking about what information is absolutely necessary for the patient to understand, limiting stuff that's not necessary, but also maybe thinking about chunking it into smaller main points. And so between 1 and 3. And if you have more than that, maybe you do 1 to 3 at a time. You kind of preview, go over them, summarize, and then move on to the next set and do the same thing, but just trying to keep it into smaller chunks so you're not just saying, here's my 10 points, one after the other. And so I already said this, but one way to repeat it without, and you don't have to literally say the exact same words, word for word. But you can like paraphrase or summarize yourself. So you preview, so here's the main points I'm going to cover, then you cover them, then you review them. And that helps patients to remember, right? Because a lot of times if you're only told something once, it's so easy to just forget it. So here's an example. This is a bunch of information about diabetes that I found online a few years ago. And again, in this case, if we can imagine that a patient were being diagnosed with type 2 diabetes and they were given all this information, it would be overwhelming. So I'll just give a brief overview of what each paragraph says rather than reading. So overview of what diabetes is, as well as glucose and insulin, information about type 1 and then type 2, information about prediabetes, talking about glucose and complications or things that can happen as a result, gestational diabetes, and then blood test information and how to manage or control diabetes. So that's a lot of information. So if we had that information and we were like, I want to try and think about how I can decrease the amount of information, reduce it down to main points, think about what those main points could be. Maybe we want to do 3. So defining what diabetes and insulin are, problems that can result from it, and then how to control it. And we could cut out information that we don't need, so about type 1, about prediabetes or gestational diabetes. So here's an example of how that could be revised. So saying, diagnosing them with type 2 diabetes and then saying we're going to cover what it is, problems that can result, and how we can take care of it. So then you would actually go over those main points. So defining what it is, as well as insulin, helps lower the blood sugar level, then what happens, so this can hurt your eyes, kidneys, and heart. You could lose an arm or leg, but to avoid this, you can exercise and eat healthy and check your blood sugar, and then summarize. So just to review what we talked about, type 2 diabetes means high blood pressure, which can lead to other health issues, like losing an arm or leg, but you can take care of it by exercising and eating healthy and so on. And so a lot of times when you do that summary at the end, you can kind of elaborate on each point. Since you've already gone over what they are, you can kind of elaborate as you review. So that might be a little bit longer than like the preview, for instance. Oh yeah, this is a really cool study from Australia where they had radiation therapists who were explaining health information to patients, And the patients spoke up and were like, I don't know what you're saying, because they were using a lot of jargon. And so as a result of that, then the radiation therapists changed the way they were communicating. They simplified their communication and explained the jargon terms, and then the patients felt like they better understood the information. So just kind of a cool example of being able to simplify information. All right, and then the last strategy I want to cover is the teach-back method. So this is the number 2 strategy recommended by those health literacy experts, so also pretty high up there. This is just when you have patients explain back to you in their own words whatever you need to know from them. So it could be what their next steps are, maybe what their treatment plan is, maybe what their health issue is, but whatever you need them to know, having them say it back to you in their own words is really important, because if they're just saying exactly what you said to them, you may not know if they actually understand it or if they're just repeating words and not comprehending them. Oh, okay, so once you do that, if they give you the information you expect, if they do it effectively, then you're done. Woo, but if they are missing information or they don't explain it correctly, then you would just tell them what they need to change, what they missed, or what the correct answer is, if you will, information is, and then you would repeat the process again. So, okay, let's try again. Now try and explain to me what you need to do, and then you just continue until they understand it. And this is something that can also be done intentionally at different points in time. So I just talked about limiting the amount of information to 1 to 3 main points. So if you have more than 1 to 3 main points, maybe you do a couple main points, then do teach back, then go over the next couple of main points, and then do teach back over those, so it's not such a big amount of information all at once for them to try and remember. And then there's also what's called the show me method. So if you need a patient to actually demonstrate something, like maybe they're using a CPAP machine or an inhaler for the first time, and you want them to actually demonstrate physically for you how to do something, you can do this same strategy as the teach back, but instead of just having them tell you, they also are going to show you what they're supposed to do, but it's the same idea. And there are 2 studies, fairly recent studies, where they've used the teach back and shown that it has been effective at increasing both understanding of patients and recall of information upon being discharged from a hospital. So with this first one, it was a randomized controlled study, so patients and these were low health literacy patients, they either received teach back or did not, and for those who received the teach back method upon discharge, they better understood their discharge instructions, significantly better than those who did not get the teach back method. But what I think is interesting, if you see the asterisk here, is that there was not a statistically significant difference in satisfaction or perceived understanding. So it's not like these patients felt like they understood it any better or they liked it anymore, but like objectively they did know more. So I thought that was an interesting finding. And then with this study, they found that for those they were looking at recall, so ability to remember the information in this case, and found that for patients who received the teach-back technique, their recall was 82% compared to only 70% when teach-back was not used, and this was a statistically significant difference between those 2 groups. And I wanted to give you some language for initiating teach-back in case it feels awkward or uncomfortable. So this is John Williams from Atrium Health. He likes to say, I'm going to pretend to be a fly on the wall today, run through your exercise program for me. Another example is you could say, hey, you're gonna probably tell a family member what we talked about today, or they're gonna ask how your appointment went today. So why don't you tell them, what are you gonna tell them about what we talked about, or what are you gonna tell them about your treatment, for instance? You could just ask, please demonstrate for me what you're going to do, if it's that show me method once you get home. Or this last one, I like this one because it kind of puts the onus on you as the healthcare provider, where it just says, we talked about a lot today, and I want to make sure that I explained it clearly. So let's review. Can you explain or describe this to me? So it's saying, I want to make sure I did a good job in my explanation. So then I wanted to just spend a brief amount of time reviewing what we talked about today with our communication strategies. So again, the first one is just avoid using jargon when possible and when it makes sense, and use plain language instead. Or to use jargon and then for the first time when you're using that jargon term, just give a definition or an explanation of it using plain language. then trying to limit the amount of information to 1 to 3 main points where possible, and then review that information using repetition by maybe doing previews and summaries. And then lastly, you could use the teach-back method or strategy. And I wanted to close with a quote from Sir William Osler: "From the standpoint of medicine as art for the prevention and cure of disease, the physician who translates the hieroglyphics of science into the plain language of healing is certainly the most useful." And I just wanted to say thank you, everyone, for being here. Again, it's been such an honor to get to talk to you. And if there's anyone listening today who's open to collaboration, whether research or communication training related, please feel free to reach out. I've got my email address here. So thank you again, and I hope you'll have a wonderful day.